Hey mamas, it's Leanne here with Nourish Lactation. We're going to talk about antenatal colostrum collection. At about 36, 37 weeks gestation, once you've spoken with your healthcare provider and been given the green light go, you could begin hand expressing your colostrum antenatally to collect and store before your baby arrives. You can express your breast as many times throughout the day as you like. A lot of moms tend to do this after a bath or a shower. You want to just start by doing some nice gentle massage of the breast, and then for hand expressing, we're always going to place our fingers kind of along the border of the areola. We never want to be right behind the nipple, and we're going to push right back into the breast wall, and we're going to maintain a little bit of that pressure back into the breast, and then it's just a gentle squeeze, and then we relax, and then we push back and we squeeze the fingers together without rolling. We don't roll or pinch forward to the nipple. We push back, we stay back, and then we gently squeeze the fingers together. You can either use it's always a needleless syringe, so a 1 ml needleless syringe, and if the colostrum is starting to come out bead by bead, then we just pull up those little beads of colostrum one by one, or for some women, the colostrum will really begin to drip, and then you can just hold a little medicine cup under the nipple and just express into the cup. But for most of the women that I'm working with antenatally, we're just often getting little beads, and sometimes we don't get anything, and that is okay. That is very normal. A lot of women do struggle to hand express before their baby arrives. If you aren't able to remove any colostrum, it does not mean that it's not in your breast. It doesn't mean that you're going to have a hard time producing milk or a hard time feeding your baby. It's just that it is sometimes easier to express for some women. So again, moms, 36, 37 weeks, talk to your healthcare provider, make sure that there aren't any contraindications why you couldn't begin antenatally expressing, and then we just collect in these 1 ml syringes. I recommend putting a little piece of masking tape or a label with the date that you've expressed the colostrum, pop that into the freezer, and when you go into the hospital or birth center, just bring all those frozen syringes with you in a plastic bag on a cooler. When you get to the hospital or birth center, make sure that the nurse puts them into the breast milk freezer. We do not want these defrosting unnecessarily. We only use them on an as-needed basis. Once they're thawed, they're only good for 24 hours. So make sure that your nurse puts them into the breast milk freezer and then defrost them as needed. All right, mamas, that's it for antenatal colostrum collection. Reach out to Nourish anytime if you have other questions or concerns, and you can find us at nourishconsulting.net. Thanks so much.